Assalamualaikum warahmatullahi wabarakatuh, and welcome to Proteins presentation. I am Muhammad Zikri bin Amiruddin, A1530, and my group members are Muhammad Alif Hakim bin Azhar, A1187, Ahmad Afif Syami bin Ahmad Rozali, A1145, Nurul Fatihah binti Rahmat, A1407, and Nur Zulaika binti Zuhuri, A1192. First of all, let me thanks to Dr. Ulul for giving us opportunity to present our assignment. As you can see on the slide, our assignment topic is diseases that are caused by impairment of protein. In my presentation, I will focus on definition of protein, function of protein, monomer and polymer of protein, protein structure, and protein misfolding. Without wasting time, what is protein? Protein is one of the three macronutrients. Two others are carbohydrate and fat. Protein is the major functional component of all cells in our body and act to facilitate biochemical reaction. Proteins contain the element CHON, carbon, hydrogen, oxygen, and nitrogen. Protein is an essential macronutrient that act to build, maintain, regulate, and repair body tissues. More specifically, the functions of protein in the body are serving as enzyme to catalyze reaction in processes such as metabolism, DNA replication, and digestion, serving as certain hormone and antibodies, and helping keep skin, hair, and nails healthy. Okay, next is amino acid. The small figure shows the general formula for an amino acid. At the center of amino acid is an asymmetric carbon atom called the alpha carbon. There are four different partners, which is an amino group, a carboxyl group, a hydrogen atom, and a variable group symbolized by R. The R group, also called the side chain, determine different type of amino acid. Different R group characterize the 20 different amino acids, then polypeptides. When two amino acids are positioned so that the carboxyl group of one is adjacent to the amino group of the other, they join by a dehydration reaction or condensation with removal of water molecule. So hydroxyl from the carboxyl of one amino acid will combine with hydrogen from another amino acid to form water. Repeat over and over and yield a polypeptide, which is a polymer of protein. Okay, so how about protein structure? A functional protein is one or more polypeptide precisely twisted, folded, and coiled into a unique shape. The protein structure is divided by four. The first one is primary structure. The primary structure is a straight or linear chain, consists of series amino acid with a unique sequence joined by peptide bond. Secondary structure refers to the repetitive coiling and folding of polypeptide. Typical secondary structure is coiled alpha helix and fold beta pleat sheet. Tertiary structure refers to the overall shape of polypeptide chains resulted from the interaction between side chains R of the various amino acids. The interaction include weak interaction and strong interaction. Weak interaction, which is hydrogen bond between polar. Next is ionic bonds between charged R group containing amine group and carboxyl group. Next is hydrophobic and van der Waals interaction among hydrophobic nonpolar R group. The strong covalent bond is disulfide bridge. Finally, the quaternary structure of a protein refers to those macromolecules with multiple polypeptide chains or subunit. protein misfolding is believed to be the primary cause of Alzheimer's disease, Parkinson's disease, Huntington disease, and many others. Why is this as incredible as it might sound? These diseases are caused not by bacteria or virus, but rather by something conceptually quite simple, which is incorrect protein folding. Then I will continue our presentation to all my group members.
The first disease that we're going to talk about is Parkinson's disease. Parkinson's disease is a neurodegenerative disorder that affects predominantly dopaminergic neurons in a specific area of the brain called substantia nigra. These neurons die or become impaired, losing the ability to produce dopamine. Studies have shown that symptoms of Parkinson's develop in patients with 80% or greater loss of dopamine-producing cells in the brain. The cause of the disease remains largely unknown. Although there is no cure, treatment options vary and include medications and surgery. The exact causes of Parkinson's disease are still unknown, but scientists believe that a combination of genetic and environmental factors are the cause of this disease. While no two people experience Parkinson's disease in the same way, there are some commonalities. The main finding in brains of people with Parkinson's disease is the loss of dopaminergic neurons in the substantia nigra, which could be linked to clumps of aggregated proteins called Lewy bodies that are found in the same area of the brain and several central nervous system structures. Scientists have studied DNA from people with Parkinson's, comparing their genes, and discovered dozens of gene mutations linked to Parkinson's. However, certain mutations seem to be more common than others, such as SNCA, which is the gene responsible for producing the protein alpha-synuclein. Alpha-synuclein is a presynaptic protein expressed through the central nervous system, and it is the main component of Lewy bodies. This is the image of structure of alpha-synuclein. Alpha-synuclein lacks a defined secondary structure and therefore has a conformational plasticity that allows it to adopt a wide range of structures depending on the environment and binding partners. Alpha-synuclein primary structure is usually divided in three distinct domains: residues 1 to 60, where there are amphipathic helices of apolipoproteins, which means having both hydrophobic and hydrophilic parts; residues 61 to 95, where the non-amyloid beta component is the most hydrophobic portion of the protein; and residues 96 to 140, where the protein is rich in acidic residues and responsible for the disordered nature of alpha-synuclein. The mutated SNCA gene produces excess alpha-syn, which accumulates abnormally in the brains of people with Parkinson's disease and is toxic because of the oligomers of alpha-synuclein. This accumulation occurs when non-amyloid beta component of the protein undergo conformational change from a random coil to beta sheet structure. Misfolded alpha-synuclein caused by mutated genes forms long fibrillar aggregates when the hydrophobic part of the beta sheet structure is exposed at the surface of the protein and interact with other misfolded alpha-synuclein. This aggregate of proteins is called amyloid deposits, which then propagates into Lewy bodies. Because of the plasticity of alpha-synuclein, Lewy bodies are able to be transmitted from neuron to neuron using mechanisms such as endocytosis, plasma membrane penetration, or through exosomes, spreading toxicity to other regions of the brain, mainly substantia nigra. This region is where dopaminergic neurons are found, and when the brain cells in this region are impaired because of the toxic, more dopamine-producing brain cells die, and the depletion of dopamine release that is necessary to maintain essential functions happens. This leads to the movement-related symptoms that can be found in patients with Parkinson's disease. Parkinson's disease is considered a movement disorder because of the tremors, slowing, and stiffening movements it can cause, and these are the most obvious symptoms of the disease. There is no single test or scan for this disease, but symptoms which are bradykinesia, tremor, and rigidity help doctors make a diagnosis. Bradykinesia means slowness of movement which happens in different ways: reduction of automatic movements such as blinking or swinging your arms when you walk, difficulty initiating movements like getting up out of a chair, general slowness in physical actions, and the appearance of abnormal stillness or a decrease in facial expression. These lead to difficulty performing everyday functions such as buttoning a shirt, cutting food, or brushing teeth. Next, the usual Parkinson's tremor occurs mostly at rest and lessen during sleep and when the affected body part is actively in use. Tremor tends to occur in the hands and is often described as pill rolling. Imagine holding a pill between your thumb and forefinger and continuously rolling it around, but it can also appear in other parts of the body, including the lower lip, jaw, or leg. These tremors can interfere with routine activities such as shaving, dressing, writing, and many other tasks that require fine motor coordination. Tremor typically affects only one side of the body, especially during early stages of the disease. With disease progression, both sides may become affected. Rigidity, while rarely the main symptom early in Parkinson's, is experienced as a stiffness of the arms or legs beyond what would result from normal aging or arthritis. Stiffness can occur on one or both sides of the body and contribute to a diseased range of motion. This can lead to problems with pain in the muscles or joints affected. Rigidity can also negatively impact sleep quality. Stiffness in the late evening and poor mobility in bed makes it hard to fall and stay asleep at night. Bradykinesia, along with either tremor or rigidity, must be present for a Parkinson's disease diagnosis to be considered. There are many medications available to treat the Parkinson's symptoms, although none yet that can reverse the effects of the disease. It is common for people with Parkinson's to take a variety of these medications to manage different symptoms depending on each patient. Levodopa is the medication most commonly given to control the movement-related symptoms of the disease. It is a natural chemical that passes into your brain and is converted to dopamine. The usage of levodopa is combined with carbidopa, which protects levodopa from early conversion to dopamine outside the brain, preventing side effects such as nausea. As the disease progresses, the benefit from levodopa may become less stable, with a tendency to wane or wear off. Dopamine agonists are also being used as medications to treat Parkinson's symptoms. Unlike levodopa, dopamine agonists are not converted into dopamine, but mimicking the dopamine effects in the brain instead. They last longer and may be used with levodopa to smooth the waning effect of levodopa, though they are not as effective as levodopa. Other medications that are used are monoamine oxidase B inhibitors. They help to prevent the breakdown of brain dopamine by inhibiting the brain enzyme monoamine oxidase B, which breaks down several chemicals in the brain, including dopamine. By giving a medication that blocks the effect of this enzyme, more dopamine is available to be used by the brain. Monoamine oxidase B inhibitors are also used with other medications, including levodopa, to reduce the wearing off of levodopa usage.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Shami, and I will continue the next part of this presentation. Okay. So another disease that was caused by the impairment of protein is called Creutzfeldt-Jakob disease. Okay. So what is Creutzfeldt-Jakob disease, or we can call it CJD. Okay, CJD is an incurable neurodegenerative disease. Okay, it means that this disease happens in the brain. Okay, this disease is rapidly progressive and always fatal. Okay, infection with this disease leads to death usually within 1 year of onset of illness. This means that you probably have 1 year or to live once you are infected with this disease. So we can see that this disease looks fatal. Okay, now we know what is CJD. Okay, let's learn more detail about this disease. Okay, firstly, we will learn the history of CJD. Okay, you can see the slide. CJD was first described in 1920 by German neurologists who are Hans Gerhard Creutzfeldt and Alphonse Maria Jacob. Okay, who gave it the name Creutzfeldt-Jakob disease in honor of these two doctors who are the first to describe this disease. Okay. Okay, then in the early 20th century, a German psychiatrist and neurologist named Friedrich Magendorfer was one of the first to characterize familiar CJD. More than 100 cases of CJD were documented in a study published in 1997, and new cases were still being reported at the time of publication. Okay, now we already know the history of CJD. So, what is the thing that causes this fatal disease? Okay, for your information, CJD was caused by abnormal versions of a protein known as prion. Okay, we can see the image of prion in the left side of slide. Okay, CJD, which is transmitted from person to person, is a type of protein that can cause normal proteins in the brain to fold abnormally when exposed to certain conditions. Okay. When mistake occurs during protein folding, the resulting prion protein is unable to be utilized by the body. These misfolded prion proteins are normally recycled by the body, but if they are not recycled, they can accumulate in the brain, causing dementia. Okay. Normal prions are technically infectious, but their infectiousness differs significantly from that virus and bacteria. Okay, next we move to mode of transmission of CJD. CJD can be spread sporadically, or through inheritance, or through contamination. However, don't worry, this CJD cannot be spread by coughing, sneezing, or touching, or sexual contact. Furthermore, we want to know the symptoms of CJD. Once we are infected of CJD, what are the symptoms that show you are infected of by CJD? Firstly, we have dementia or memory loss. Next is instability and disorientation, or loss of balance and coordination. Next, jerking motions. Next, progressive loss of brain function and mobility, slurred speech, and the last is vision issues and blindness. Based off all of these symptoms, we can see how fatal this disease can cause to us. And now we have reached the last part of CJD. So after we talk about everything about CJD, we want to know how this disease can be treated or cured. Unfortunately, there is no effective treatment available for curing CJD or any of its variants. This is what I mean. The CJD is an incurable neurodegenerative disease. A large number of drugs have been tested and have failed to demonstrate any benefits. So, as a result, doctors concentrate their effort on alleviating pain and other symptoms, as well as on making people suffering from this disease as comfortable as possible. Sedative and antidepressants, for example, can be used to treat psychological symptoms of CJD. like anxiety and depression, and medicines like clonazepam and sodium valproate can be used to treat muscle jerks and tremors. Okay, so for the conclusions, diseases cannot be treated. So once you infected by the disease, you will surely will die. But however, doctors making the effort to make us comfortable as possible. Okay, so I think that's all for my part for this presentation. Okay, thank you.
Huntington's disease, or also known as HD, is a condition that stops parts of the brain working properly over time. It is passed on from a person's parents. It gets gradually worse over time and is usually fatal after a period of up to 20 years. In the history, Huntington's disease is named after George Huntington, who described it among residents of East Hampton, Long Island in 1872. It is a hereditary neurodegenerative disease. In 1993, a collaborative group of investigators discovered the gene that causes HD. As a result of this discovery, it is now possible to diagnose HD with blood or tissue samples. The etiologies of HD. Number 1. Mutation. The HTT mutation that causes Huntington disease involves a DNA segment known as a CAG 3-nucleotide repeat. This segment is made up of a series of 3 DNA building blocks, cytosine, adenine, and guanine, that appear multiple times in a row. Normally, the CAG segment is repeated 10 to 35 times within the gene. In people with Huntington disease, the CAG segment is repeated 36 to more than 120 times. People with 36 to 39 CAG repeats may or may not develop the signs and symptoms of the Huntington disease, while people with 40 or more repeats almost always develop the disorder. Another etiology of HD is inheritance. This condition is inherited in an autosomal dominant pattern, which means one copy of the altered gene in each cell is sufficient to cause the disorder. An affected person usually inherits the altered gene from one affected parent. In rare cases, an individual with Huntington disease does not have a parent with the disorder. As the altered HTT gene is passed from one generation to the next, the size of the CAG 3-nucleotide repeat often increases in size. A larger number of repeats is usually associated with an earlier onset of signs and symptoms. This phenomenon is called anticipation. People with the adult onset form of Huntington disease typically have 40 to 50 CAG repeats in the HTT gene, while people with the juvenile form of this disorder tend to have more than 60 CAG repeats. Symptoms of HD. The symptoms usually start at 30 to 50 years of age, but can begin much earlier or later. Some common symptoms of Huntington disease including cognitive decline, mood swings, involuntary movements, hallucination, speech difficulties, and behavioral and personality changes. The early symptoms of Huntington disease, including number 1, difficulty concentrating, number 2, memory lapses, number 3, depression, including low mood, a lack of interest in things, and feelings of hopelessness, number 4, stumbling and clumsiness, number 5, mood swings such as irritability or aggressive behavior. Later problems in Huntington disease: involuntary jerking or fidgety movements of the limbs and body, difficulty speaking clearly. Eventually, they may find all communication very difficult. Swallowing problem, they may choke on food and get lung infections such as pneumonia from food going down the wrong way. Increasingly slow or rigid movement. Personality changes. Sometimes they may change so they don't seem like their former self at all. Breathing problems and difficulty moving around. They may eventually lose the ability to walk or sit up by themselves. There is currently no cure for Huntington's disease and no way to slow or stop the brain changes it causes. Treatments focus on managing symptoms. A group of international experts recommended the following treatments as first-line strategies for 3 of the disease's most troubling symptoms. Symptom number 1, chorea, or also known as involuntary movements. Some experts believe beginning treatment with an atypical antipsychotic drug such as olanzapine is the best. Others start with another type of drug recently approved by the US Food and Drug Administration, especially for Huntington's, called tetrabenazine. Symptom number 2, irritability. For severe anger and threatening behavior, experts agree that an atypical antipsychotic drug is the preferred approach. For less severe non-threatening irritability, experts recommend first trying a selective serotonin reuptake inhibitor (SSRI), which is a type of antidepressant. 3. Obsessive compulsive thoughts and actions. Experts also recommend SSRIs as the standard treatment for these symptoms.
Assalamualaikum and a very good day I wish to Dr. Ulul and all my friends. My name is Laika and now I am going to talk about Alzheimer's disease, which is one of the diseases that caused by impairment in protein. Over a century ago, a German doctor called Alois Alzheimer spotted anomalies in the brain sections from a patient with dementia. Since then, people have been studying about Alzheimer's disease. The etiology, which is not completely understood yet, are cause of plaques and tangles in their brains. First, I will explain about the plaques. There is a membrane of the neuron in our brain, which contain molecule called APP, which is stand for amyloid precursor protein. The normal process of broken down this protein is when the alpha secretase and gamma secretase teams up and chop up the APP, so it will produce soluble peptide. But for Alzheimer's patient, there is beta secretase that teams up with gamma secretase, which is produced insoluble peptide. So this insoluble peptide is called amyloid beta that tend to be sticky, and it will bond together forming beta amyloid plaques. Beta amyloid plaques will join between neuron and neuron that will disrupt signaling in brain cells, so it will cause memory impair. Day by day, these plaques can start up an immune response and cause inflammation which might damage surrounding neurons. Next is tangles. Just like other cells, neurons are held together by their cytoskeleton, which is partly made up by microtubules. There is a special protein called tau that makes sure microtubules is not break apart. Although again not completely understands, It is thought that beta amyloid plaques build-up initiates pathways that leads to activation of kinase. Kinase is an enzyme that transfers phosphate groups to the tau protein that cause tau protein to stop supporting the microtubules and gets tangled with other tau protein that leads to other characteristic finding of Alzheimer's disease, which is called neurofibrillary tangles. So, neuron with tangles and non-functioning microtubules cannot signal as well and end up programmed cell death. Move on to the next part, which is pathology. As neuron dies, large-scale changes start to take place in the brain. For one, the brain atrophies or shrinks, and the gyri get narrower, which are the characteristic regions of the brain. As those get narrower, which are the groups, the sulci, which are the grooves between the gyri, get wider. With atrophy, the ventricles, the fluid-filled cavities in the brain get larger. The example of symptoms of Alzheimer's patients are they tend to forget about recent conversations, always misplace items, hallucination, and delusion. The last part is treatment. As we all know, there is no currently cure for Alzheimer's disease, but there is medicine that can temporarily improve some symptoms such as acetylcholinesterase inhibitors and memantine. Acetylcholinesterase inhibitors increase levels of acetylcholine, a substance in the brain that helps nerve cells communicate with each other. Memantine works by blocking the effects of an excessive amount of a chemical in the brain called glutamate. Memantine is usually used for moderate or severe Alzheimer's disease. That's all from me. Thank you.
So, as a conclusion from our presentation of the disease that caused by impairment in protein, it is because of mechanism of different protein folding disorders. It is clear that newborn polypeptide change can go in the wrong direction due to certain gene mutations, which occur in almost all familiar neurodegenerative disease or mature native proteins can also reach wrong faults in adaptation within cell. Therapy should therefore aim to inhibit and reverse conformational changes in the protein molecule responsible. The misfold protein is rich in beta sheet and therapy should involve designing a peptide to prevent and reverse beta sheet formations. It might be possible to correct this disease by persuading the misfold protein to fold correctly. There is no doubt that chaperones play a critical role in controlling protein misfolding and thus reducing the threat of associated misfolding protein disease. That's all from us. Thank you.